In this video, I want to talk with you about the most common beliefs regarding psychotherapy, so-called talk therapy. I hear those a fair amount of time from my patients visiting a mental health practice. Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. So what should you expect? This is a logical question if you never had therapy before. Before you start your therapy, it's very important to talk about your expectations and to set your goals with a therapist. So, in this video, I want to clear up 5 misconceptions to avoid possible unrealistic expectations which can get in the way of your commitment to therapy and the recovery process. Number 1. My therapist will tell me what to do and will fix everything for me. This is probably the most common misconception. The role of a therapist is not to give you his own opinion or how you should run your life or how to heal. The therapist usually will not tell you exactly what to do or which choice you need to make. Instead, he or she can help you to seek your own answers within yourself, to learn to look at yourself, to acquire new possibilities. Yes, the therapist can give you tips or information, helping you to improve your skills and awareness about different ways of thinking related to your problem. The therapist will guide you to consider other options you probably would not have imagined before, or maybe learn you to accept or tolerate things you can't change. Number 2. Psychotherapy is like talking to a friend. Talking to a therapist is not the same as chatting with your friend, even if it may feel like a casual conversation. Therapy is confidential, has clear boundaries, and focuses only on you. The therapist is a trained professional. He or she may help you to make connections with your hidden emotions, to look at your thoughts, and to help you change the way you think. And finally, your therapist will not judge you and will be objective. Number 3. Only crazy people need therapy. Unfortunately, that is a stigma too. People are aware that you need to go to your doctor if you have physical pain or visible damage to your body, like a broken leg. But we often don't think of taking care of our brain in the same way we take care of our body. There are many different reasons people seek psychotherapy. You don't have to have a serious mental disorder to go to a therapist. Psychotherapy can help with a number of life stresses and conflicts that can affect anyone. Sometimes it takes a professional from the outside to help us with our insight and give a healthier perspective on what's going on. Your mental health affects all of other areas of your life: social, physical, financial, and so on. So don't let stigma prevent you from getting help. Number 4. Psychotherapy can help me to find forgotten memories. Modern research reveals that memory itself is far less reliable and much more malleable than commonly believed. No matter how strong and vivid memory may be, the human mind is desperately prone to fallibility. It means that our memory is not accurate about what happened in the past. Sometimes people are looking for unremembered trauma. Many techniques used in the past by some therapists worked also extremely well to implant false memories to create realistic experiences of things that never happened. The discovery of forgotten memories can never be a goal in therapy. It's unethical and even dangerous. Number 5. Some psychotherapies are better than others. Are some psychotherapies more better than others? Here is no straightforward answer. In general, different studies suggest that no psychotherapy is more effective than any other psychotherapy. However, some psychotherapies are more effective for some mental health problems than for others. The type of psychotherapy that's right for you depends on your individual situation. Some work better than others in treating certain disorders and conditions, but in many cases, therapists use a combination of techniques. For example, cognitive behavioral therapy was designed to treat depression, but its uses have been expanded to include treatment of a variety of mental health conditions. Another example is EMDR. This therapy was developed for the treatment of post-traumatic stress disorder. Now EMDR has been found to be effective in treating of depression, different forms of anxiety, some somatic disorders, low self-esteem, and so on. These were my top 5 the most common misconceptions about psychotherapy. I hope this video was informative for you. If you like this video, give it a thumbs up, share with your friends, and don't forget to subscribe. Thank you for watching, and I hope to see you next time.